Hyperthyroidism is high T3 and T4. When a patient is hyperthyroid, they have elevated T3 and T4 levels, and the TSH, or thyroid stimulating hormone, is usually very low or suppressed. This is because the thyroid stimulating hormone that is produced by the anterior pituitary tumors is extremely rare. Hyperthyroidism due to oversecretion of TSH is secondary hyperthyroidism and very rare. In the case of hyperthyroidism with high T3 and T4 levels and low TSH, it can be due to autoimmune disorders such as Graves' disease, which can be severe hyperthyroidism, or early thyroiditis, which is usually a more mild case of hyperthyroidism. Hyperthyroidism can also be due to adenomas of the thyroid. Large ones that are greater than 3 centimeters can be severe. And in this case, we would again see high T3 and T4 levels with a low TSH. Hyperthyroidism can also be due to excess thyroid medications, and this can be a mild hyperthyroidism. But again, T3 and T4 is high, and TSH will be low. Autoimmune disorders of the thyroid include Graves' disease, and in this case, antibodies are mimicking the action of thyroid stimulating hormone. In thyroiditis, the antibodies are actually attacking the thyroid tissue. Graves' disease is also called toxic goiter or thyrotoxicosis. Hyperthyroid diffuse goiter. In Graves' disease, the TSH is usually suppressed, and so it's very low. In Graves' disease, immune globulins or antibodies that mimic thyroid stimulating hormone stimulate the thyroid to excessively grow, releasing excessive T3 and T4. Thyrotoxicosis means the thyroid hormone levels are so high that they are toxic and dangerous. Symptoms of hyperthyroidism can include intolerance to heat, thinning hair and hair loss, weight loss, and heart palpitations. Other symptoms can include diaphoresis or excessive sweating, insomnia, abnormal menstrual cycles, and exophthalmos. Exophthalmos is protrusion of the eyes, and here we see a picture of that in this woman with Graves' disease. Can you see the goiter in her neck? Exophthalmos example 2 is another picture of a woman here with Graves' disease. She also has a visible goiter in the neck. So thyroid hormone controls metabolism, and thyroid gland is the master of metabolism. So people with thyrotoxicosis can have 40 times the normal metabolic rate. Thyrotoxic crisis or thyroid storm is a life-threatening process when there is a toxic excess of thyroid hormone. In this crisis, patients may present with severe tachycardia, heart failure, shock, hyperthermia with temperatures up to 105 degrees, agitation, seizures, and even coma. The cardiovascular manifestations of thyroid storm are immediately treated with beta blockers, such as propranolol or Inderal, which is a blood pressure medication. Other treatments for hyperthyroid include antithyroid drugs that block T3 synthesis. Propylthiouracil, or PTU, is one such drug, and so is Tapazole, or methimazole. Iodine, also known as Lugol's solution, can actually inhibit T3 production. So remember, large rapid doses of iodine can actually inhibit the production of T3. Radioactive iodine ablation therapy is another treatment for hyperthyroidism in which the radioactive destruction of the thyroid gland takes place. There can also be surgical removal of a nodule or surgical removal of the entire thyroid. Thyroiditis. Antibodies are not imitating any hormone function. They are actually attacking the thyroid tissue.